So I would love to say good evening and thank you all for joining us tonight for our New York City Department of Veteran Services in collaboration with the New York City Department of Mental Health and Hygiene Town Hall. We're excited to share information with you tonight regarding information about the vaccines that are currently being administered here in New York City and to answer some frequently asked questions. So happy that you have joined us tonight. I'd like to introduce myself. I am Melissa Walters, the Director of Aftercare and Prevention at the New York City Department of Veteran Services and the agency's vaccine lead. I will be your moderator tonight. Just want to start by saying during this past year, all New Yorkers have been faced with some disconnection, some isolation, and unfortunately, some losses due to the COVID-19 pandemic. Now, with the new vaccines, we are looking towards a more hopeful future. We are here tonight to share information and to answer questions about the 3 vaccines that are available to New Yorkers, the eligibility criteria, and how these vaccines can protect us. I'd like to also make a note. Please send your questions and comments in the chat box, as we will be closely monitoring and collecting all of your comments and questions in hopes to answer as many as we can at the conclusion of our presentation. I'd like to say that our presentation tonight will be led by Dr. Timothy Stiles of the Department of Health and Hygiene. And so at the end of Dr. Stiles' Vaccine 101 overview, we would like to have a Q&A where you will get the opportunity to ask questions, and we will again be monitoring the chat. For those of you who are calling in, please use the chat because we would definitely like to see your questions and have answers. We also will be providing some links in the chat box. I'd like to start off by introducing Commissioner James Hendon, my commissioner of the New York City Department of Veteran Services, who is committed to ensuring through this collaboration with the Vaccine Command Center in tonight's event that we bring you this information, the information to the veterans of New York City, as well as to some of the city leaders and agencies that serve veterans, military families, caregivers, and survivors. It is truly my pleasure to introduce the Commissioner of the New York City Department of Veteran Services, Commissioner James Hendon.
Hey, Melissa, thank you so much for that introduction. And, before I begin, just want to give honors and salutations to many of the people who are with us this evening. In absentia, I want to recognize Council Member and Chairman of the City Council's Veterans Committee, Hendon. Also recognizing who is with us tonight, Citywide Veterans Director Joe Bello, Dr. Timothy Stiles from the Department of Health and Mental Hygiene's Emergency Preparedness Unit, and a captain in the Navy. And, Shauna Stribula and Persephone Tan from the New York City Vaccine Command Center, Chelsea Cipriano, Executive Director of Intergovernmental Affairs at the Department of Health and Mental Hygiene, Anna Schatz, Community Coordinator for DOHMH, who really helped to make this town hall a reality for us to inform our veterans on why it is so critical for this folks to receive this vaccine and the 5 W's of it. And last but not least, I want to recognize members of our own DVS team. Aftercare Prevention Coordinator Melissa Walters, LMXW, Press Secretary Alan Houston, Digital Outreach Manager Gil Feliciano, and all others who are taking the time to be here with us tonight. Welcome to this event. Good evening. My name is James Hendon. I serve as Commissioner of the New York City Department of Veteran Services. As Melissa said, the mission of the New York City Department of Veteran Services is to connect, mobilize, and empower New York City's veteran community in order to foster purpose-driven lives for military service members past and present, in addition to their caregivers, their survivors, and their families. When you hear that mission, we talk about purpose-driven life, but a precursor to purpose-driven life is maintaining life. Everything we can do to continue to facilitate an environment where our brother and sister veterans and their families, their loved ones, are able to live is critical, and it's what brings us here this evening. You can't have that discussion about life without talking about the fight against the current enemy of the day, which for us is the coronavirus. There are many people who are viewing this who have been a part of conflicts, large, small, near and far, across oceans, across sea, across air. Yet for this current conflict, it is nuanced because this is not an enemy that we can see. This is not an enemy that we can speak to. This enemy is the virus itself. This enemy is a lack of information. This enemy is a lack of vigilance, often lack of vigilance. And this enemy is ultimately an embrace of fear. It is critical for us to empower all who are members of the veteran community and beyond with the tools to combat this enemy. It's not just about combating that enemy for you and your own lives, but for those close to you as far as loved ones, for those close to you as far as friends, and those close to you as far as colleagues. And so tonight, as we go through this presentation, the main goal for the evening is to make sure that you have all of the tools that you need to combat what is in front of us with this current pandemic. Anything that you may not have the appropriate information on, please ask the question, get that information. Any fears or any hesitancies you may have, please put those out there in the open so that we can address them. Any knowledge that you need to have as far as what to do to connect the dots with accessing the vaccine and accessing any other resources, please bring those to bear so that we can address them and make them available to you. If we don't equip you appropriately for this fight, then we cannot be assured that we collectively will win. And that is the name of the game, not only today, but beyond, to continue to win so that we can foster those purpose-driven lives and continue to see the growth and expansion and evolution of our veteran community and of the city and of the nation and of the world. And so with that, just so happy once again to be with you tonight. And I can't emphasize enough, ask us the questions if you need to ask them. Their only bad question is one that is not asked. You can always reach the Department of Veteran Services also at 212-416-5250, 212-416-5250. You can email us. It's connect@veterans.nyc.gov, connect@veterans.nyc.gov. Our social media handle is @NYC Veterans. Once again, that handle is @NYC Veterans. And our website is nyc.gov/vets. Once again, it is nyc.gov/vets. So that being said, just happy to turn over to the person who will follow me. Speaking on behalf of City Council member and Chairman of the Council's Veterans Committee, Hendon, who regretfully could not be with us this evening, we are happy to welcome Citywide Veterans Coordinator Joe Bello. And when it comes to both Councilmember Deutsch and Coordinator Bello, these public servants are both lions within our community, and we appreciate the work that they do in the council day in and day out on behalf of our veterans. Ladies and gentlemen, Joe Bello.
Good evening, everybody. Hope all are doing well. Thank you, Commissioner Hendon, for that introduction. Just want to take a moment on behalf of the councilmen to thank everybody for being here this evening. And the commissioner is absolutely right. Information is key about the COVID vaccine, about all of us getting it. In fact, if I'm not mistaken, the commissioner got his shot today, or one of his shots. So congratulations on that. I myself have gotten both my shots from the Manhattan VA. So it's very important that we defeat this virus and get those shots. And this is a good forum to learn and get information about how we can do that, not just from the VA, but through the city as well. So I appreciate being here, and thank you very much for having me.
Thank you. Thank you, Joe Bello. So good to see you, and thank you for being present tonight. Thank you so much, Commissioner Hendon, for your words. I would like to move on to our main panelist speaker tonight, Dr. Timothy Stiles. I'd like to introduce you to our subject matter expert. He is from the Public Health Services and the Department of Health and Mental Health Hygiene. I will give you a little background about Dr. Stiles, who is a veteran himself. Dr. Stiles of the New York City Department of Mental Health and Hygiene is a captain in the United States Public Health Service Commission Corps officer, currently assigned to the New York City Department of Health as the medical director of the Bureau of Health Care and Community Readiness. In the Office of Emergency Preparedness and Response, he has been on active duty for over 17 years, for the first 8 years with the United States Navy as a flight surgeon and preventative medicine physician, and for the last 9 years with the Public Health Service as senior medical officer, primarily supporting state and local public health departments in preparing for and responding to disasters. During the COVID-19 pandemic, Dr. Stiles has been supporting the health care system in surge response activities and vaccine coordinations. And so it is truly my pleasure to introduce Dr. Timothy Stiles. To you, Dr. Stiles.
Thank you, ma'am. I appreciate that. And thanks, everyone, for having me. Thank you for the service and sacrifice of you and your families over the years. And I feel honored to be able to be here and give you some of this information. I hope to give you a little bit of background on some parts of the pandemic response that we have so far in New York City, as well as some background on the vaccines, as well as where to access. So with that, I'm going to start just giving you a little bit of background on, where we started with this and what we've seen in this pandemic. So if we can go to the third slide, please. Yep, one more right there. Thank you. So really, we need to look at racial injustice in our society and how that has kind of been pervasive in this pandemic as well. And differences in health outcomes is apparent due to long-term structural racism, including some of the policies in discriminatory practices in our society we've seen in communities of color, and having access to vital resources such as healthcare and housing, food, and opportunities of employment and education. And it's negatively affected overall health and well-being, and that's been played out in this pandemic. For decades, really policies have created these inequalities, racial inequalities in work, health, wealth, and education. And impact is really clear when we look at COVID-19. More Black and Latino people have been sick, hospitalized, died from COVID-19 than any other racial and ethnic groups. Communities most impacted by COVID-19 are also disproportionately represented in the essential work setting, such as healthcare facilities, factories, grocery stores, and because of these occupational segregation and unequal wealth distributions in New York City. So many essential workers had no choice and had to work during the worst of the pandemic and were exposed to COVID-19. Pre-existing conditions for which put people at greater risk for severe outcomes, such as health conditions or their social economic backgrounds, and political injustices such as poor air quality and unsafe and unstable housing have led to additional discrepancies in their effect of COVID-19. So with that, next slide, please. So our approach and commitment in New York City, we recognize this systematic inequalities, and the New York City Department of Health is ensuring that equity is at the foundation of all aspects of our COVID-19 response, including vaccine access. Since the start, we've been working with partners in a hyperlocal response to support and address needs in communities most impacted by this pandemic. We must address the longstanding mistrust of the medical community and government due to historical and continued mistreatment of people of color and immigrants, LGBTQ+ individuals, and other groups, especially as New Yorkers face the decisions of whether or not to get vaccinated. We will provide people with the facts and information they need to inform decisions about vaccination, such as information in this presentation about COVID-19 vaccines, how they were developed and monitored, how they work, and what to expect when you're vaccinated. Next slide, please. So as you can see here, we have made some incredible progress since the vaccine program had begun in mid-December, starting with healthcare workers. In the United States overall, over 113 million people have received at least one dose was administered, and in New York City, over 3 million people with over 1 million people being fully vaccinated. And I can explain that a little bit more as we go into the vaccines, why the difference of administration versus fully vaccinated. Next slide. So while the vaccination numbers are important and we're seeing a turning point and some light at the end of the tunnel, it's really important that we must remember that we're still in the midst of a second wave. The graph on the left shows the daily reported cases in New York City since the pandemic began. And that spike that we see was that first wave, which was so, such a negative effect on the city in high numbers of deaths and hospitalizations. It looks a lot different in the sense of where we currently are with this wave as you look at the right of that graph. Only because we think about the numbers of people that we could test back in the early days. We didn't have the tests available to us now. So you see many more of the positive cases because people with lower symptoms have been able to be tested. However, we still have numbers of individuals hospitalized and still dying every day that we don't want to see. Over on the graph to the right, you see a 7-day % positivity by zip code throughout the city. And you see those dark areas that indicate still a high level of positive transmission. So even though we have this light at the end of the tunnel and we're excited about vaccines, we must continue to work on flattening this curve still and keep wearing our face masks and staying home when we're ill and physical distancing, still those core elements of preventing spread of this virus. Next slide, please. So here we're looking at vaccination by race, ethnicity, and zip code in New York City. And on the left, we see a breakdown of who has been vaccinated by race, ethnicity. The darker areas show that more people have been, more people have been fully vaccinated. And these tables reflect the disproportionate number of white individuals that have been vaccinated compared to Black and Latino. And on the right, you can see the areas that have been most effective compared to the slide before, as far as still positive high rates, show that they're under-vaccinated when looking at the percent of vaccination. Next slide. So really, we want to talk about some of the key messages. These vaccines will help protect us from COVID-19, and that's what we're going to focus on in this presentation. So as we go through the details about the vaccines, it's important to keep in mind these key messages and access that we want everyone to understand. So vaccines, they save lives by helping people develop immunity or protection from the disease so that their body can defend against it when they're otherwise exposed. COVID-19 vaccines are safe and effective. The vaccines are free for everyone. COVID-19 vaccines are available to people of all immigration statuses, and vaccination is not a public benefit under the public charge rule. When people receive vaccine, their privacy will be protected. Importantly, we will not just say these statements, we will provide people with the facts and information they need to make the informed decision about vaccination, such as the information in this presentation about COVID-19 vaccines, how they were developed and monitored, how they work, and what to expect when you get vaccinated. Next slide. So we're going to talk a little bit about development now. So when scientists develop an idea for a vaccine, they first work through some of the problems in the laboratory. If the lab test's initial looks are successful, they can turn to clinical trials, which means that they test the vaccine on volunteers. There are 3 phases of vaccine clinical trials. Each studies whether the vaccine works and is safe. At first, phase 1, they begin with a very small number of people to give the vaccine. Phase 2, the study increases and several hundred people start to get the vaccine, and they look at their safety as well as what they call the efficacy, or how well it works. Phase 3 typically include thousands of people who either receive the vaccine or no vaccine to compare that to, and that really gives them the understanding of how well it works. And then ideally, the people in the studies have characteristics like age, health conditions, race, ethnicity, similar to the people who will ultimately receive the vaccine if approved. After the vaccine is authorized for use, sometimes clinical trials continue to assess long-term outcomes of the vaccine to look for other health effects or positive effects down the road from the vaccine in the general public that weren't or were seen in the earlier phases. Next slide. So vaccines must be reviewed by the U.S. Food and Drug Administration, or FDA, before they can be used. So the clinical trials and so forth have to get permissions to begin, and then with the vaccines, the FDA has a very high level of involvement. They want to ensure the safety of the vaccines. The FDA reviews the clinical trials, plans, and protocols to make sure that the procedures meet the highest scientific and ethical standards. The clinical trials were closely monitored by data safety monitoring boards made up of outside experts. These are medical personnel, ethicists, statisticians, patient advocates, and other groups. FDA scientists and medical professionals evaluated all available information to determine the vaccine should be authorized or not. And the U.S. vaccine safety system ensures that all vaccines are as safe as possible. Next slide. So in an emergency, the FDA may allow vaccines to be used before they are officially licensed by issuing what's called an Emergency Use Authorization, or EUA, so that we can start using the vaccine right away. Importantly, this does not mean it's a shortcut. It is not a shortcut where we're taking it all. In fact, all vaccines issued in EUA must go through the same clinical trials that all other vaccines do. And the EUA can be issued only if the evidence strongly suggests that the benefits far outweigh the risks to any patients of the vaccine itself. So next slide. The COVID-19 vaccines are being monitored more closely than any other vaccine developed in U.S. history. The FDA and the Centers for Disease Control and Prevention, or the CDC, and other federal agencies and organizations continue to monitor the safety of these vaccines as they are used. Also, all providers who administer the vaccines are required to report any certain adverse events that may be related to the vaccine, and they report this through what's called the Vaccine Adverse Reporting System, or VAERS, which is managed by the CDC and FDA. Also importantly to know that the vaccine recipient, the person getting the vaccine, can also report side effects through this VAERS process, or CDC has created what's called vSafe. It's a smartphone app, and through this app, people can report their own side effects and other information about what they felt after receiving this vaccine. And it provides the CDC more real-time data about vaccines and what people are experiencing any more than any other time in history. Next slide. So the development of COVID-19 vaccine has involved unprecedented resources. Billions of dollars have been spent, and hundreds of scientists from around the world have been working on vaccines nonstop. In developing the COVID-19 vaccine, scientists built on many years of research from other vaccines, including research on vaccines for other coronaviruses, the same family of virus that causes COVID-19. Also, the federal government provided special funding to allow the development, testing, and production to happen at the same time. So, for example, companies could start manufacturing vaccine even before they were done studying them in their phase 3 trials. This usually isn't done because if the vaccine is found not to be, have safety concerns or something and not approved, then they would have wasted millions of dollars producing something that they now need to throw away. However, the urgency of the COVID-19 pandemic was worth the risk in the federal government to invest in this possibility. Also, the federal government, state, and local health departments and healthcare providers have been working for months on the planning around storage, distribution, the supplies necessary, and other logistics associated with getting this vaccine off the ground. Next slide. So there are 3 vaccines that have been authorized by the FDA for use at this time. The Pfizer-BioNTech messenger RNA or mRNA vaccine, the Moderna mRNA vaccine, and the Johnson & Johnson or Janssen adenovirus vector vaccine. And I'll explain a little bit more about what each of these mean, but there are several other vaccines still being tested in clinical trials right now. We just don't know yet if or when they will be approved in the U.S. for use. Next slide. So we'll start with the mRNA or messenger RNA vaccine. So both Pfizer and Moderna are mRNA vaccines. COVID-19 messenger RNA vaccines contain genetic material from the COVID-19 virus. The mRNA are molecules that provide the instructions, basically. So while an mRNA is a new type of vaccine technology, it has been studied for over 30 years, so it's not exactly new. But looking at the diagram at the bottom, this is how it really works. So the mRNA enters the body with the instructions on how the protein that is part of the virus that causes COVID-19. These proteins the proteins produced by reading these instructions trigger the body to make antibodies and other defenses. The mRNA is broken down right away and destroyed by the body. If a person, though, is later exposed to COVID-19, the body remembers these instructions and sees a similar protein on the COVID-19 virus, produces the antibodies, and fights it. So the mRNA, you can think of it a little bit like an email. Stay on that side, please. Oh, one more second. Sorry about that. Think of it more like an email you send to your immune system. So the email has the instructions about what the virus looks like and how to kill it. And then the email gets deleted. So it isn't until the virus comes along again that it then reuses those instructions that it previously knew. It does not, the mRNA itself does not affect or interact with any person's DNA. It's an important point. Next slide, please. So the Johnson & Johnson or Janssen vaccine is an adenovirus vaccine. And Johnson & Johnson has been researching Janssen is a company that is working with Johnson & Johnson, and they have been researching the adenovirus vector vaccine for other infections for decades. Including the company has an approved Ebola vaccine, which is already in use to stamp out outbreaks of Ebola currently in Africa right now. So the Janssen vaccine works similar to Pfizer and Moderna's mRNA, though it uses a different type of messenger to deliver those instructions. So the Janssen vaccine, scientists took a gene from the virus that causes the COVID-19 illness and put the gene into an adenovirus. And an adenovirus is just a common cold virus. Many of us get an adenovirus illness every year. But our bodies, respond to it really quickly because we've seen it all before and we just have a mild cold. But it's used because it's effective in delivering this information to the body to help to cause a defense. So the adenovirus is used in this vaccine is modified, so it can't multiply in humans or cause illness. So you won't get a cold because of it, though. So there has been some modifications to it. So when the vaccine enters the body, the adenovirus carries the gene that causes COVID, the gene from the virus that causes COVID-19 into the human cell, which then makes a COVID-19 protein. The protein is not the virus itself. It's just, again, a little piece of it, a look like it. And that protein triggers the body to make antibodies and other defenses similar to those mRNA vaccines. When you're exposed then to the COVID-19 after you're vaccinated, your body again will recognize it, quickly develop the immune system, ramp it up, and fight the illness. Next slide, please. So this chart provides a little bit more information about the 3 vaccines and their clinical trials. As mentioned, both the Pfizer and Moderna vaccines are mRNA and this requires 2 doses. so it's something I didn't mention just previously, but the mRNA vaccines begin to trigger that response, but you need another dose depending on the vaccine, either 3 or 4 weeks later to help amplify that response so your body's really ready to respond to a virus if you get exposed. Johnson & Johnson, or the adenovirus vaccine, requires only 1 dose. All 3 vaccines can cause mild to moderate illness, feeling lousy, usually for a couple of days, which we'll discuss in a little bit later on. As for the clinical trials, all 3 involve tens of thousands of study volunteers of different ages, races, and ethnicities. A key difference to the Pfizer vaccine was it was authorized for a person 16 and older, whereas the Moderna and Johnson & Johnson vaccines have only been authorized for those 18 and older. There are also differences in how the vaccines can be stored, which impacts really who can keep them and really who they can be made available to. Johnson & Johnson vaccine can be stored in a regular refrigerator for longer periods of time, and it's more stable for transporting. This, combined with it being 1 dose, makes it really ideal for reaching hard to reach populations such as those who are homebound or in populations that may be hard to provide a second dose. Next slide, please. So in the how well do these vaccines work? In the clinical trials, all 3 vaccines were shown to be safe and effective across all ages, race, and ethnicity groups. Importantly, no one receiving any of the vaccines has died from COVID-19, and all 3 vaccines were very effective in preventing COVID-19 illness and hospitalization. As for how well the vaccines work against emerging variants, we still have a lot more to learn on that topic as the virus does shift. New variants continue to be discovered as well, but based on preliminary data that we're seeing from trials that continue or ongoing and laboratory testing, the use of the vaccines since being authorized, all 3 vaccines likely produced protection against the new variants that we've seen and been monitoring, although the protection may not be as strong as what was originally shown in the initial study. So it is something that we need to continue to watch. Next slide. So what we still don't know, or do know and don't know about the vaccines. So we know that the vaccines are safe and effective, and that they will reduce COVID-19 and save lives. There are still many things we don't know about the vaccines, and some things we will learn with time. Some of that is how long the protection or the immunity you develop from the vaccines will last, whether additional doses will be needed in the future, whether the vaccine are safe and effective for children. Remember, just the Pfizer was 16 and older, although there are new studies ongoing on Moderna for younger age groups, but we still don't know. And whether the being vaccinated prevents people from spreading the virus to other people. The good news is that there's a growing body of evidence that those that are fully vaccinated are potentially less likely to transmit the SARS-CoV-2 virus, or the virus that causes COVID-19, to others. So this last one I mentioned is we're starting to get a little sense that there is some protection against that. But the more we learn, you think about these vaccines have only been with us and in the community for just 3 months now. So it's still a time process to continue to collect this information and learn from them. Next slide. So it's normal to feel nervous about taking a new vaccine. However, the COVID-19 vaccine has been shown to be safe and effective and has many benefits to you, your community, and to New York City. So, if your question is, why should I get vaccinated? Well, it does protect you from COVID-19. No matter what age you are, if you're eligible to receive it, it will help. The COVID-19 or COVID vaccine can help prevent some of these very serious consequences that the COVID pandemic and virus has caused. So the serious consequences like hospitalization and deaths, or health problems that last even after you're no longer sick. The long COVID syndrome you may have heard of. Even if you've had COVID-19, it's important to be vaccinated as it lowers your chances of getting it again. Second, getting the vaccine may protect those around you. So particularly the people who can't get vaccinated. If you do have to be close to someone like that, you're helping prevent getting them ill if you keep yourself safe. And it helps protect them who are at higher risk of complications from COVID-19. And then third, the vaccination, along with other preventive measures, is how you help everyone. We help each other get out of this COVID-19 public health emergency and get to a spot where we have some return back to some normalcy. Next slide. So let's talk a little bit about getting vaccinated, all right? So since there's not enough vaccine available all at once, the vaccines are distributed in phases. And I'm sure by now many of you have heard about how things are going with the rollouts in different groups. But the New York State, the governor's office and the Department of Health determines how groups are prioritized for vaccination and the timeline for distribution. New York State's planned distribution is based on CDC's Advisory Committee of Immunization Practices, or ACIP, that sets the guidance for the country. In general, people that are being prioritized fall into two categories initially, which is at increased risk of COVID-19, or those that are increased risk of having really severe COVID-19 illness if they get it, especially those who are more at risk for hospitalizations and death. This slide lists those currently eligible groups, and we'll present in a later slide where you can go and look for updated information as these do change regularly. Next slide, please. So the state may add additional categories, as I mentioned. So it's this slide right here where we have information on where else you can go. It's natural to feel really eager to want to go get your vaccine, especially after months of this physical distancing. But it will take a little bit of time, and we're looking at spring is ahead, and we hope, as you've heard from President Biden, to have it all available for every one in the U.S. by the end of May, which would be really great when we were thinking how long it normally takes to develop vaccines, and yet we have 3 extremely safe and effective vaccines right now. So please check out our website and keep a current eye on it to see when or where you become eligible for the vaccine. Next slide. So we are committed to ensuring equitable access to the COVID-19 vaccine for all New Yorkers. This means opening vaccine sites in communities most impacted by COVID-19, limiting some sites to specific boroughs or zip codes, and making appointments available through community-based organizations, or CBOs. Making sure New Yorkers have the information they need in the language that they speak to make clear and informed decisions about the vaccine. Working closely with clinical CBOs and clinical partners and faith-based organizations and community leaders across New York City neighborhoods. Listening and responding to the community concerns and input. This includes trust and acknowledging and taking steps to address historic and present-day context of race, racism, discrimination in our system, our institutions, and this country. Monitoring data and community feedback to identify gaps in access and enable focused response. Next slide, please. So a little bit more on who can and cannot be vaccinated. We talked a little bit about this previously, but the first thing to note is it will be available at no cost to everyone, whether you have health insurance or not. If you do have health insurance, it may be billed an administration fee, but you should not be charged a copay or other fee. Also, the vaccines are available to everyone regardless of immigration status. It is important to understand that the vaccines will not be available initially to children, as I discussed a little bit earlier, younger than 16. This is because it was first tested for more rapid rollout in adults, and the information we have about safety is preliminary based on those trials in adult populations only. All other groups can be vaccinated. Many clinical trial participants had underlying health conditions, and the vaccines were safe and effective with them. So when we talk about people with medical conditions such as immune, if their immune systems have difficulty because of cancer or something, if they have diabetes, they are currently on the list that they're able to receive the vaccine as it's been shown to be safe and effective in those groups. The only restriction is for those that may have had an allergic reaction to COVID-19 vaccine itself. We're talking about an anaphylactic reaction that makes someone severe allergic reaction where they can't breathe or to one of the ingredients in the vaccine itself as well. So if that's happened, if someone has had an anaphylactic reaction previously, that's something to discuss with a healthcare provider. For some groups, such as pregnant women or those breastfeeding, or those with weakened immune system, there's limited data about safety and efficacy of the vaccine or effectiveness. These groups can still be vaccinated. If you're concerned at all, again, talk to your provider to make sure that you get any of your questions answered about your specific condition. Next slide, please. For current eligible groups, some people, such as some healthcare workers or groups group living care workers, can get vaccinated through their employer. So that's one of the sites you can get vaccinated. Other city and state sites are available. They've opened across the city. Some hospitals, federally qualified health centers, and pharmacies are also vaccinating eligible members. And down the road, we expect the vaccine to be more available at urgent care centers and doctors' offices. It's important to take a look at the vaccine finder for New York City sites. If you go to the web address there at the bottom of the slide, you'll be able to click through any site near at your convenience or your location towards your home, your place of work, and it tells you information on which vaccine they provide, as well as how to get in touch and try and make an appointment. Next slide, please. So some steps you want to take in thinking about getting vaccinated. Make sure that you fall into one of the eligibility groups. We have heard of a lot of people who have signed up for appointments, but when they presented, they may or may not have had the information necessary and weren't in the eligibility group and had to be turned away. Second step is to find a vaccine site near you and make a scheduled appointment. You can see New York City and other vaccine sites at our vaccine web finder, which I just discussed. And you can also call and make an appointment at a New York City site through the 877 VAX for NYC. So 877 VAX for NYC. And you can also reach out to your healthcare provider and see if they are one of the affiliated affiliation with the hospital or something, they're able to provide that vaccine to you or your loved ones. Step 3, you have to fill out a New York State vaccine form. Some basic information about yourself, affirming that you're eligible. It's required. The provider should make sure that you've done this before you receive your vaccine. And that information on where to access that form is vaccineform.health.ny.gov. The next step is on the day of your appointment, remember to bring your proof of eligibility. That information is also can be found in the website from the step 1, which is making sure you're eligible. So what eligibility paperwork would you need to bring? For workers, this can be a work ID, a letter from your employer, a paycheck stub. So if you were a restaurant employee, you can get a letter from your employer or a pay stub that shows that employment. Other evidence of current employment or proof of work that you work in New York. For people who are now 60 or older, you bring just an ID or document that shows your date of birth or proof of New York residence. Some sites may require that you have a photo ID, so it's good to know what you need to bring. And then make sure that you wear a mask or face covering. Wear one on the way to get vaccinated, your entire time at the vaccination site, and then continue to wear them until we're all in the free and clear. But you will not be admitted to any site without the use of a face covering. And then the last step is if you got the Pfizer or Moderna vaccine, you have to make an appointment for your second dose. Ideally, that's done at the same time in which you get the first dose. Next slide. This is an image of what the vaccine finder looks like. You can use Google Language Assistants to change the languages. It's red on the slide in the upper left. You can type in an address or zip code of where you live or where you want to find a vaccine site, and you'll see a ton pop up on the screen nearby. It doesn't always mean they have vaccine right now. There is still limited supply, so I just want to make that clear. It still can be, it still may take a little bit of time to get that appointment, but I do want you to know where you can go to find these appointments. And then each vaccine site manages their own schedules and appointments. So the locator provides a phone number or an email address in which you can make that appointment based on location. And then appointment availability is dependent on supply, as I just mentioned. But keep checking back regularly because we keep getting vaccine in every week. Next slide, please. For the Pfizer and Moderna, you will need to receive that second dose. These vaccines offer some protection after the first dose, but protects you even more after the second dose. The vaccine is fully effective 2 weeks after your second dose. And that's where you get those really high levels of effectiveness that you may have heard of in those studies after the 2 weeks. The second dose should be the same vaccine as your first dose was. For example, if you got the Pfizer, you need to have the Pfizer for your second dose. When you schedule the second dose, it's slightly different depending on which vaccine you received. So if you received the Pfizer vaccine, you need to schedule the second dose 21 to 42 days after the first dose. And if you had the Moderna vaccine, you have to schedule the second dose 28 days to 42 days after the first dose of Moderna. You should not get the second dose earlier than recommended. The studies just didn't show necessarily what that effectiveness would be. You cannot get your second, if you cannot get your second dose during that time interval I just discussed, get it as soon as possible after that 42 days. No matter how much time has passed, you should still get that second shot if you received a Pfizer or Moderna on your first dose. And you'll still only need the two shots when you do eventually get it. When you get the first dose, the other thing you'll get is you'll get a proof of vaccination card listing the vaccine you received and the date you received it. So it's important to remember to keep that card nearby so you can remember when to go for your second vaccine and which vaccine you received. Next slide. So most people report some side effects from the vaccines, which are usually normal sign of the body is beginning to build that protection for you. And with a two-shot vaccine, it's usually more, you'll feel some more on the second vaccine. But the common side effects are soreness and swelling on the arm that you received the vaccine. You may get a headache, body aches. A lot of people get fatigue or tiredness, and then some have even reported fever. Side effects are usually mild to moderate and start within the first few days after receiving the vaccine and clear up a couple days after that, usually 1 to 2 days. And they're less common in older adults. For the Pfizer and Moderna vaccines, as I mentioned, they're a little bit more common after the second shot. But it's important people understand these side effects are to be expected. As I said, it's really showing your body is developing that immunity. I was serving as a vaccinator in one of our vaccine sites and did receive my vaccinations. And, I experienced some of these side effects after the second, and I was actually very happy I did because it showed my body was mounting a good response to prepare and help myself and protect myself from the virus. Next slide, please. So what do you do if you get side effects? Well, you can call your provider if you have any side effects that are of concern or do not go away after a few days. My side effects lasted about 6 to 8 hours. I've heard some last around 24, and it really does depend on the individual, but it shouldn't last more than a few days. Or if that redness or soreness where you got the shot really lasts more than 24 hours, it can be a sign of an infection in the area. For the Pfizer and the Moderna vaccines, get the second shot even if you have side effects from the first shot. It's important to really build that immunity level to the highest point for its effectiveness if you were to be exposed to the virus. You can call 311 if you have questions about any side effect potentials or side effects that you have. They can connect you and put you in touch with someone at the health department. Next slide. And allergic reactions. So based on what we currently know now, serious allergic reactions are actually really uncommon. You can talk to your provider if you previously have had allergic reactions to a vaccine or injectable medication, or if you're allergic to any of the ingredients in the vaccines. You should receive this information when you go to the vaccine site as well. People with a history of severe allergic reactions not related to vaccines or injectables, such as allergic to food or a pet or venom, environmental or latex, you can get vaccinated. It's not a related concern. Allergic reactions are different than side effects. They generally start within a few minutes. The severe allergic reaction can include difficulty breathing, swelling in the face and throat, fast heartbeat, bad rash all over your body, dizziness and weakness. And if you think you've had a severe allergic reaction after the vaccine, then you call 911 or go to the nearest hospital. We do monitor everyone who receives the vaccine for at least 15 minutes after getting the vaccine to just make sure we're not seeing any of those early signs of any kind of severe allergic reaction. And if you have had a reaction to a vaccine before, but you and your provider discuss and you think, yes, I'm going to get the vaccine, we might keep you 30 minutes just to keep a closer eye on you, but we would still provide that vaccine. Next slide. So after vaccination, getting the vaccine is the most important way to protect you from the severe illness, hospitalization, and deaths from COVID-19. However, we still need to be cautious until a higher percentage, more people are vaccinated in the city as well as across the U.S. and the world, until we have a better understand how well the vaccines really protect people who have not been vaccinated. So still, stay home if you're sick. Maintain some distance from others. Wear face coverings when you're outside of the home and wash your hands. There is some new information that CDC released about getting together with other people who have been vaccinated. And I encourage you to try and take a look at that as well, because it gives you some understanding of, what they think protection can be like and where we're hoping to go, where we can all eventually start leaving that mask at home as well. We'll be updating our guidance as some of these, as more information comes in about the protection, long-lasting, or how long-lasting it is, and safety in preventing getting illness from others. If you have been vaccinated, don't really show signs, but could pass it to others, that may affect how quickly we're able to move into that phase where we can all take off these masks. Next slide, please. So what can you do right now? Well, it's important, as we still are in this second wave, that we need to keep getting tested and practicing the core 4 strategies to help protect our families and friends. Take care of your mental health. There is support if you need assistance. Call New York City Well or reach out to chat or text. You can also help amplify the important messages about COVID-19 vaccines and their importance. Continue checking our website and frequent updates and information on social media to amplify these messages. And if you'd like to arrange for a speaker for a future event, you can call us or email us at the email address provided here on the slide. And with that, next slide, I'd just like to thank you for having me, and I'd be happy to take some questions.
Thank you so much, Dr. Stiles, for that very informative presentation. We had some questions ahead of time, and your presentation covered so much material. And so we're going to jump in with the last amount of time that we have into the Q&A portion. Right before we jump into Q&A, I'd like to mention that we do have a representative from the VA if any questions come in specifically from for veterans who are eligible for VA healthcare. Also, I would just like to, prior to going into the Q&A, I'd like to share information for the veterans and military families who would like information specifically about the VA. So if you are eligible for VA care and are a part of the VA, you can get more information regarding the VA hospital and its resources by calling the VA Nurses Helpline to schedule a visit at 1-800-877-6976. Again, that's 1-800-877-6976, or you can visit the VA website at www.va.gov/coronavirus. Again, that's www.va.gov/coronavirus. These links will be in the chat. For more information regarding the Bronx VA, you can call 718-741-4640. That's 718-741-4640 to get an appointment. That is specifically for Bronx VA in order to schedule an appointment. You can also call the VA centralized scheduling hotline at 1-877-877-9267. And again, we want to cover all aspects of the VA community. We definitely want to provide information regarding veterans who are not service connected, as well as veterans who are. Also, just want to add that DVS is definitely here to support and help you. Just want to reiterate that our Commissioner, James Hendon, is definitely committed to being here as a city agency to support veterans, military families, caregivers, and survivors. So I'd like to give you our number again at 212-416-5250. And you can reach us at www.nyc.gov/vets. So I know we just have a couple of minutes, and I would just like to thank you again, Dr. Timothy, for that very informative presentation. But I do want to just ask maybe 2 questions. And here's one question. Am I still required to wear PPE after I have been vaccinated?
Yeah, thank you for that question. Like I tried to mention, it's important after vaccination to continue to wear a mask out in public and try and maintain some physical distance from folks for some of the reasons we talked about is others who may not have been vaccinated yet may be still susceptible. We do not know how effective it is in completely preventing you potentially from transmitting to someone if you had been exposed but aren't really feeling any symptoms because you were vaccinated. So if the vaccine works, the point is you'd never feel anything, but we don't fully know yet how well it works in preventing that spread from others. Some really early indications are it looks really good, and that will help lead to that point of we will be able to recommend people take off their masks. But until that point, the other part is to make sure we get more of the population vaccinated. I didn't mention herd immunity in here, but herd immunity is really about getting a high percentage of people in the community vaccinated, where it's much harder for that virus to spread and take hold into any community. We're still really trying to protect those people who haven't been able to get the vaccine yet, who are still very susceptible to severe disease and illness. And until we can cover all those and keep those hospitalizations, out and save some lives, we really need to all still take those precautions.
Thank you so much, Dr. Stiles. And I also want to say to the audience, if you have any questions, please feel free to put your questions in the chat. We want to have this Q&A for the community. And so please put your questions in the chat if you have any questions for our speaker, as well as we do have one of our VA reps on the line to answer questions. So I do want to ask another question. If this is a question regarding about the dose, what happens if I don't get the second dose within the required time? As both the Moderna and the Pfizer are different kind of time sequences, and do I have to actually start over?
Yep. No. Thank you for that question. It's a good one. You never have to start your series over. We're recommending that if you are unable to get that vaccine in the time you're supposed to, so again, for Pfizer, it's supposed to be between 21 and 42 days after the first dose. And the Moderna is between 28 days and 42 days after the first dose. However, if you can't get it and it's after that 42 days, we still recommend you get it as soon as possible, and you do not need to restart the entire series.
Okay, thank you so much, Dr. Stiles. I do have another question, and this is about individuals concerned with the people around them. So what happens if I get vaccinated, but those around me, say incarcerated individuals, colleagues, or family members don't get vaccinated?
Yeah, it's a good question. And one of the things, by you being vaccinated, you protect yourself. So if they do become ill, if you're exposed to them and you've been vaccinated, the indications of the vaccines are really effective in preventing hospitalizations and death. You could still get ill, especially as we learn of some of these variants and other things that are being developed out there. But all indications that we're seeing right now are that they really are effective in helping prevent those severe illnesses. So I can't say by you getting vaccinated you won't have an illness at all, but really to try and prevent you from having a severe illness. But and we do think that by you being vaccinated also helps prevent those around you who are unvaccinated. Like I said, we still don't know well enough yet, so we still need to wear the face masks and everything and keep social distancing as much as possible. But if those barriers got broken down for one reason or another, we still think it's more effective to have the vaccine to prevent you from being able to give that virus to anyone else as well.
So thank you so much, Dr. Stiles. I do have a question from the audience, and this question asks: I have been fully vaccinated. How long does the vaccine last, and will we need a booster shot?
So in the presentation, I tried to. I know it went so fast. There's so much information in there. So thanks for asking that again. It gives me a chance to really emphasize that. There's still a lot of things we're learning about this vaccine, all three vaccines, but any of the COVID-19 vaccines. they've been around so short a time. We've only been really using them now for 3 months. We don't know how long overall they're going to last to protect people. So we don't know yet whether or not we're going to need to get boosters in a year. Is this going to look like influenza where, it's recommended every year we get kind of a booster shot of a flu shot? We don't know at this time. We're hoping not, but I think the possibility is there if the virus changes that, they might need a booster in the future. But I don't think any one of us has enough information on how well the vaccines work over the long haul to know whether that's going to be the case or not.
Okay. Thank you so much.
Mm-hmm.
So there is another question in the chat that I want to ask you, Dr. Stiles. I'm so sorry. No. So I do have another question. If I am trying to get pregnant, do you recommend that I get the vaccine? And how safe is the vaccine for pregnant women?
Yeah, thanks for that question. There wasn't a lot of information in the studies on pregnant women, just like with children, or specific medical conditions. So there's not an understanding exactly, but it's not unlike some vaccines that are live viruses or live attenuated, they call them. It's not a full virus, so there's no indication at this point that we think it would have an effect on pregnancy. So we do recommend people speak with their provider, but it is not a contraindication. In other words, we don't not recommend it for those that are pregnant. We do provide the vaccine for those that are pregnant. We just don't have a lot of great information on how it makes you feel or anything like that.
Okay. And I do have another question regarding pregnancy. And as far as say a new mom would need to breastfeed, are there any findings on how that affects a person who has gotten vaccinated and their ability to continue to breastfeed?
Yeah, thanks for that. It's similar to the prior question. There's just not enough information on that right now. I think we'll get some more, but we're not using. We do not feel that a woman breastfeeding right now is a reason not to get the vaccine. And really in pregnancy, especially a little bit further on, the negative effects of COVID-19 on someone who's been pregnant has really pushed us to want to recommend getting the COVID-19 vaccine if they're pregnant. So I think the ACOG, which is the Academy of Obstetricians, really, and gynecologists really do recommend getting the vaccine as well. So I do suggest talking to the provider, but that's one where we can try and protect the mom, from getting a severe illness, which can only, cause a problem during the pregnancy as well.
Thank you so much, Dr. Timothy, because one of the things we know that there is still some hesitancy, and just getting this information is definitely helping us as a community to better understand the vaccine and the need to get vaccinated. So I'm going to ask one last question. I did share some information regarding the VA and how to access eligibility and get an appointment through the VA. So I definitely want to ask this last question. If veterans are not eligible to get vaccinated at the VA, and those links that I sent and the telephone numbers will definitely help those who are connected to the VA for healthcare or want to find out about their eligibility. But for veterans who are not eligible to get vaccinated at the VA, where can they go?
Yeah, great. So in our presentation, we'll make sure you have this information as well. But on the city's Department of Health's website, the vaccine finder, and you can just type in NYC vaccine finder, can provide information on available sites in New York City. And the NYC or Vax for NYC is another phone number that folks can reach out to. Also on our website, we have links to those that are eligible too, and we update those regularly. So, any New Yorker is eligible, if they meet the eligibility requirement, can be vaccinated in these sites.
Thank you so much, Dr. Timothy Stiles. So I want to begin our wrap up now. This has been so informative, and definitely want to just make sure, does anyone else within the audience have any questions? Would like to take an opportunity to pose a question in our chat before we close? Just kind of want to put that out to the audience and just make sure we don't have any more questions from the audience for Dr. Stiles or for our VA rep that is on the line. Okay. So I want to close by saying a special thanks to you, Dr. Stiles. This forum has been so informative. I know, and we all know that, the vaccines for a lot of us is very new, but just getting this information is definitely adding, more information and education about the specific vaccines, what we would go through to get the vaccine, as well as side effects, how we are really protecting ourselves and each others, our loved one in the community. And we definitely feel very committed to ensuring that the veteran community, their family members, their loved ones, their caregivers are definitely informed and have access to the information, regardless if it's from our VCC or the VA. We definitely want to cover all bases. So I would like again to thank you, Dr. Stiles, for this information and presentation. Definitely want to thank and give a big thank you to the VCC team for all of your support. Also like to thank Commissioner James Hendon for your support and for your insight to put this together. And Joseph Bello, thank you for being on, the Citywide Veterans Coordinator for Councilman Chaim Deutsch, as well as the DVS team for all of your contributions to this event. I just want to go one more over our links. And so just want to let the audience know that this forum will be live on our social media. It will be on our YouTube as of tomorrow. So the content and the information you will be able to have access to. Again, I would like to give the information for COVID-19 vaccine eligibility and to make an appointment. That is at nyc.gov/COVID vaccine, or you can call 877-VAX4NYC. That's 877-829-4692. Again, if you're eligible for VA care or a part of the VA, you can get information at the VA. For more information on the VA hospitals and its resources, you can call 1-800-877-6976, or you can visit the VA website at www.va.gov.coronavirus. You can get information for the Bronx VA by calling 718-741-4640. That is the appointment hotline, as well as going to www.bronx.va/services/COVID-19 vaccines. And you can also call the VA centralized scheduling hotline at 1-877-877-9267. Of course, I would be remiss to not mention that DVS is definitely here for all veterans of New York City, and you can find us at www.nyc.gov/vets, or you can call us at 212-416-5250. So with that said, I want to thank everyone for taking the time to be a part of the town hall, all of our panelists, as well as the audience. Definitely want to encourage you all to continue to be safe. Let's all use this wonderful information Dr. Stiles shared with us, and not only keep ourselves safe and our loved ones safe, really just ensuring that New York City would move back to what we know as our norm. So I thank you all again, and I thank everyone. Have a good evening.